Radiologist. I work with this group called the Himalaya, having been a clinical pharmacologist and a clinical researcher introducing a variety of anti-cancer drugs. I have now come back to nature, and I take a cue from the last slide that Mr. Umesh showed. If you guys were partying and if Guru and Kaushik had provided you alcohol, fermented grape juice, I would have said, use this. Use it before, use 2 tablets before and 2 tablets after. Well, I'm amidst you this evening to be talking in terms of what this organization, I'm sure, known to you. Has everybody heard about Himalaya? Alright, so if you've heard about Himalaya, you've heard about Live 52. Well, I can always begin by saying I come from a company that manufactures Live 52. We would just look at how, if you look at this country where only 20 or 30% get modern medicine, the so-called modern medicine, allopathic medicine, where we essentially practice a reductionist approach. And if one is looking at how our Prime Minister suddenly started talking in terms of, maybe thanks to his association with Ramdev, about providing alternate medicines, about providing Ayurvedic medicines. We were looking at 70 to 80% of the population essentially depends on alternative systems of medicine. And they are looking at how you can go ahead, the World Health Organization also is talking in terms of if 60 to 70% of our population gets alternate medicines, can we go ahead and improve the status of how we work with Ayurvedic medicines? So, if one is looking at health and talking in terms of a perfect balance of properly functioning life forces, metabolic and structural and excretory systems, talk in terms of clarity, sense organs, together with mind and consciousness. If you look at the holistic approach of Ayurveda, I'm sure we would talk in terms of Prasanna, Atma, Indriya and Mana. And this is way back in the 1600s, Sushruta talking in terms of how we are, as humans, a combination of the body, spirit and mind. If one talks in terms of has India done something in this area of integrating Ayurvedic or complementary alternative medicines? Yes. Around 2005, I remember being a part of the NIMITLI, where the Indian government suddenly said, if you have Ayurvedic medicines or complementary medicines, can you go ahead and look at how you can, try and develop these drugs and transform the herbal R&D to try and get drugs that could suit use by allopathic physicians. So we have situations where we have looked at herb selections based on traditional knowledge. So the wisdom, the ancient wisdom can get related. You can go ahead and today we are talking of fingerprinting most of these herbs to ensure you get hold of the best herbs that can treat disease. Look at polyherbal formulations for situations which are functional or multi-pronged etiology. Look at going ahead and look at evidence to ensure that these drugs are working, synergize research. Look at how at the molecular level, if I were to talk in terms of Live-52 and say it's a hepatoprotective, could I go about and talk in terms of how it could improve the hepatoprotective action of the liver by increasing levels of cytochrome P450? And also there are situations where we are looking at the cellular level and try to understand how some of these drugs could work. We in Himalaya strictly practice good clinical practice, so you can talk in terms of most studies done by us do follow strict guidelines as that governs the allopathic medications. We have good laboratory practices and our GMP facility has been approved by the World Health Organization. Not only are we in India, in fact we market in 92 countries and our presence in 92 countries, also in the United States as dietary supplements. We have a variety of products that are certified. They are organic in nature, they are additive free and are available as per the mandate of the United States DSHEA protocols. If you go back and talk in terms of how the science of life, one of the oldest healing systems in the world, dating back 5,000 years, has looked primarily at holistic approach, essentially from botanicals. I'm sure, for us, we are aware of the fact that Vinca came out, essentially a plant-based source of pectidexin. They play a crucial role both in preventive and curative healthcare. And Sushruta again was talking in terms of swasthya, or health in Ayurveda, as a concept of what the World Health Organization talks about: physical, mental, and emotional well-being. We have some of our pharmaceutical products, the wellness spectrum as we call it. These are single herbs. We have a range of consumer products, all of them essentially getting tested traditional method to ensure their safety and efficacy. We have personal care products, products that are being approved by the US FDA to be present there, as well as animal healthcare products. Interestingly, the R&D center of the Himalaya Drug Company consists of over 200 researchers, a core team of 200 multidisciplinary scientists, if I'm right. We have tie-ups with a variety of universities. We also have association with the government of India, and we have good laboratory practice certified labs that are doing animal testing prior to human testing. So if you look at how some of our products are chosen, we identify them essentially based on literature survey, have detailed knowledge of their pharmacognosy, we fingerprint them, we ensure they are evaluated before and standardized in terms of formulation. They get across to be understood in terms of what sort of formulations could be used. We run efficacy safety studies both in animals. We also do phase 1, 2 and 3 for clinical research. In fact, we have a product that we did some work with the Ramaya group where we clearly shown that there is a promising immunomodulation possible when we use this agent. So I will come back to that, but then a few words on LIV52. Well, this was born in 1955, the same year I was born, and therefore this has survived 60 years, and so have I. A registered pharmaceutical specialty in Switzerland, the only herbal medicine to be ranked amongst the top 10 pharmaceutical products in India. We have as many as 264 clinical trials, and for those of us who know Rustum Jal Vakil, I have a paper from Rustum Jal Vakil which talks in terms of how many of his patients benefited with LIV52. This drug is prescribed as an adjuvant in the treatment of tuberculosis in Russia. And talking of Russia, the positioning strategy for LIV52 in Russia is 2 before and 2 after glass of vodka. Alright, now we also have moved subsequently to another agent called LIV52HB, looking at the risk of hepatitis B virus and how we would be able to offer cost-effective herbal immunomodulator. We have gone ahead and evaluated the efficacy. It's comparable to allopathic drugs, 38 to 60% viral clearance. In terms of cost-effective, well, if you look at the antiviral costs in terms of $1,800 US for 6 months, we have LIV52HB 6-month therapy at $85. Well, this is a drug that has got registered based on strong clinical research conducted at a variety of centers. So we had this turmeric oral rinse. We wish to present to you an open label comparative 3-arm study that was done. This is done locally here in Bangalore. We were looking at an objective of evaluating the clinical efficacy, safety of turmeric oral rinse in oral mucositis in patients with chemotherapy, radiotherapy. We looked at a study design that was a parallel 3-arm study, had turmeric mouthwash, 2 variants of that with normal saline. We treated patients for about 6 weeks. I'm given to understand the study is getting over end of this month. These patients were followed up for 6 weeks. We did evaluate the oral mucositis score as per standard norms, and having done that, we were able to look at how, when you do the mucositis score and sort of rank our products, I thought I told you I had 3 of them. We looked at oral turmeric rinse without xanthine gum as something that was really favorable in terms of producing clinical results, and therefore we went back and requested the Ramaya Hospital if we could extend this study. So we are likely to be extending this study to incorporate another 60 patients. So this is a early phase 2 study. In a phase 3, we will have 60 patients at Ramaya, about 90 patients from the Shankara group, to give us 150 patient data on the safety of this small turmeric rinse as a mouth rinse for mucositis. We have yet another new drug, Immusante, which is offering broad spectrum immunotherapeutic support. This drug has been tried out for a variety of indications, but if one looks at what we have been able to summarize so far in our phase 2 studies, is the fact that it's a natural formulation with potent herbal actives proven to improve resistance and prevent disease manifestation. We spoke in terms of Vyadi Shamatva, and this has indeed shown some effect. And in this area, I would like to talk in terms of how it offers broad spectrum immunotherapeutic support, essentially by looking at non-specific immunomodulation, working both on humoral as well as cell-mediated immunity. We have gone ahead and have trials that prove how it modulates the inflammatory cascade, elicits cytokine gene expression, how it can significantly improve neutrophils, macrophages, and NK cells, leading to better phagocytosis. We have certain studies that are documenting clearly that immunomodulation is now emerging as an alternative promising treatment. We could have herbal immunomodulators to activate the host defense system, strengthen the weakened immune system, and will work most effectively as adjuvants in therapies to ensure faster, stronger immune response. We're likely to be coming back with Immusante to again oncologists who would want to sort of try this out. I know of the fight that medical oncologists and radiation oncologists had. I have an old friend called Puri. So I would love to come back and look at how we could look at some of these herbal agents that could help improve quality of life in cancer patients. Should there be interest, I know we have colleagues who will try and help us out creating clinical data on such things. Thanks so much, and I thank you for giving me this opportunity. Since we also are hosting dinner and all of you are our guests, we talk in terms of Atiti Devo Bhava. Enjoy the dinner. I'm sorry there is no prasanna. Prasanna is fermented grape juice. I'm sorry there is no prasanna, but I'm sure you will go back home prasanna. Thank you so much.
So moderator for the session. This is, we have put the key evidence